الرحمن الرحيم إن الحمد لله والصلاة والسلام على رسول الله. Jazakallah khair, everybody, for joining in for the lecture of the 12 lecture series that Balagh has organized completely free for students and also for the people in general as well. For those of you who are joining us for the first time, just to let you know, these series of lectures are designed to cover the medical, psychological, and spiritual perspectives associated with the coronavirus pandemic, and we'll be discussing them primarily from the Islamic perspective, but also there will be a lot of academic discussion, discussion about the cause of the illness, what can we do, what can be mitigated, how it can be mitigated. And today, for those of you who have been hearing the news, we have officially passed the 1.1 million mark in terms of worldwide cases, and 60,000 people have died due to COVID-related illness. It's a huge landmark, a very, very sad day indeed. So today, we have got Dr. Mohammad Munir with us. He's a virologist at the Lancaster University. Assalamu alaikum, Dr. Munir.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. So over to you. The plan is, inshallah, that you will have a chance to present your talk, inshallah. And at the end of it, we will take questions from our attendees. The attendees can ask questions if they want to during the talk as well. So you must be able to see a Q&A tab, so you can send your questions through that. And inshallah, we'll give Dr. Munir a chance to answer those questions at the very end. So over to you.
Okay, thank you. Thank you very much. Is my screen clear?
Absolutely, we can see it absolutely clearly.
Okay, perfect. Let me just get rid of this. I will be right back. Anyways, Assalamu alaikum, everyone, and good evening. My name is Mohammad Munir, and I'm a virologist at Lancaster University. And today I will take you through some of the fundamental concepts about the virus itself and the kind of damage it is causing. So this lecture is a little more toward the virus than the Islamic perspective, but it is also important really to consider what's going on in the research so that we can incorporate in the context of Islamic perspective. So before and after, you will be having more lectures that would put the research into perspective. Before I go into detail of this talk, I would just want to highlight a few things. First thing is that I will not take a lot of time for lecturing. What I will do is to really skim through some of the fundamental concepts, and then I will leave plenty of time for question answers so that we really understand personal circumstances, and we will have enough time to discuss those. One more thing is that, as some of you might have already expected, that we have diverse audience from not only UK, but across the world. Some of them are the general public, other are student, academic. So we really need to find some balance. So if you think that it is too basic, it's because you are academics. And if it is too technical, probably you belong to the general group. So there is something for everyone. Before I go into, just want to say that whatever I will be saying today is my personal stance. And whatever I will be saying today is either scientifically justified or scientifically backed up. And whatever I will say is my own stance, not a Lancaster University stance. And also to highlight that whatever I will be saying today will likely to change because we are dealing with something that we haven't seen before. So some information might change down the line. So just to give you overview what we will be talking in next 20-25 minutes, first thing is very important to understand where virus hides, where it survives, how long it survives, and what we need to do really to get rid of it. Very basic question. The second thing is about the face masks. As some of you might have already been hearing, that face masks is now getting pace and is becoming a little more controversial than it was before. So we will try to clarify the face mask wearing. Another thing that we will touch upon is reinfection, because some of you might have already some questions and concerns, so we'll try to clarify those as well. The next topic we will be covering is lockdown ending. Now, as you know, most of countries in the world, they are in lockdown in one way or other, depending on the intensity of the disease. So there is always a question like when we will be phasing out the lockdown. So we will discuss those soon. And then is the safe shopping, because in most of the countries here in the Europe, the only or probably the only important or essential trip to other places is really only going for the shopping, because otherwise all the advice and the guidelines are that stay home. The last thing we will touch upon is about available antiviral trials and the vaccine ongoing, because many people are concerned about that. There is loads of information over the social media, whether that is true or not, and we'll touch upon those in a minute. So before we go deep into the discussion, let's touch upon where do we stand at the moment. As been mentioned before, it is unfortunate that 1.1 million people have already been infected. And this is extremely unprecedented. We haven't seen such diseases in a long time that has such a high level of contagiousness. So the virus itself has a history of nearly 3 months, and that it has touched every corner, almost every corner in the world. Sadly, 60,000 people already died, but the important thing to consider in mind is that still there are 233,000 people, those are recovered from the infection. So the chances to recover is also very high. Looking on to really the overall scenario around the globe, as you can see from here, on y-axis the number of deaths, and on the x-axis are the days passed after the country has reported 3 daily deaths. So France, Spain, and Italy, they have applied draconian measures in terms of social distancing, in terms of locking down their cities, and then expanding toward the whole of the countries around 70 days before, really, so depending on which part of the country you talk about. So now, as you can see, the deaths are going down, although they are still on an average 500 daily, but they are plateauing, they are leveling. So which is really good news for us to consider that the social disruption we are having at this moment is really gonna pay off. Although that is not the case in the UK or the United States, because they were a few weeks behind the infection itself. And China is really getting to the normal itself. South Korea has already been at a very nice place right from the beginning because of the strategy they have adopted in the beginning. So since I'm speaking from United Kingdom, I can't live without telling you guys that unfortunately we have around 4,000 deaths, and new cases are increasing day by day. And this increase in number of cases is not just because the virus is getting so much into the population, that is also down to the diagnostic assays. Those are ramping up and more testing are being performed. So overall situation is certainly grim and serious, but that is how it is. So just to remind few things over here, like what kind of sign and symptoms are really at the basic scale, because understanding these one really help you to see if anyone unfortunately is getting into that infection stage. One of the things that has recently really triggered so much onto the media is that the initial sign appeared to be taste and smell lost. So some people who are very sensitive, and they can feel that they can't taste or smell any longer, and that is probably the first sign. And soon after, it start to go a little bit of fever, dry cough. That is very common with the coronavirus compared to flu, where there is a lot more productive cough. Shortness of breath is the next stage. Fatigue, muscle pain that start to appear. And in the terminal stages is really the respiratory distress. That is the time when the virus go deep into the lung and where it start replicating and sort of causing the damage to the functional part of the lung. And when it reached to this stage, then there is a need for ventilator. That is the time when artificial support is required. And there are two different kinds of this ventilators spore. One is the non-invasive spore, where it does not require intubation. So just putting mask onto the the supply of the oxygen onto the face, and then it required intubation. So major emphasis of the healthcare system is really at that stage, because these are those patients, those are at a critical stage, and these are the ones who require a specialized, personalized treatment, which is a major burden for the healthcare system. So since ventilators in normal circumstances are not required at that level, this is a respiratory disease. So the scale of the intensity is really high, and the demand for the ventilator is really high, is because every person who get into the critical stage, one way or other, they require the ventilator support. So just to recap, majority of us now already understood that there is a certain age predisposition, and also there are different health conditions that make people more vulnerable to this infection. We already know that from 60 plus, they are in a highly likely situation to get adverse effect of this infection. We do know the cardiovascular diseases, diabetes, respiratory hypertension, smoking, drinking, all these are the health conditions that can make people more vulnerable to the adverse outcome. Male and female, the difference is getting shorter, but still male are the ones that are dying because of coronavirus compared to female. But one thing that need to be very clearly understood is, now if we look onto the data of United States and to Italian perspective, there are young people, those are also dying, and on a high proportion. So young people from 20 to 40, which you can't see much based on the data generated from the China outbreak, is no longer the case in Italy and in United States. The factors those are contributing to those are still unknown, but there are some predisposition factors such as alcoholism, such as smoking. All these are the factors that are contributing to the young people vulnerability to this infection. So one thing is very important to understand: how long the virus stay onto the surfaces. I know that this is not a new thing. Many people have already been, getting this information from here and there. Purpose of myself to put this slide up is really to emphasize onto the fact that the data I'm telling you is the one that is specially conducted to answer this question: for how long virus stay onto inanimate surfaces. So the coronavirus stay onto the surfaces from 3 days as low as 3 hours. And this difference is depending on the nature of the surface, the temperature, and the humidity. Okay, so at a room temperature, the virus stay into the air up to 3 hours. Onto the plastic, which is one of the major commodities for our daily life, like water bottles, from bought to many applications in kitchen. All these are having plastic surfaces, so it can stay up to 3 days onto the surfaces. And then there are other materials which are also very common in our daily life. Those includes like steel, copper door handles. Those are also very common. Caution need to be taken for really looking onto the door handle, because that is a communal place where people touch upon very frequently. Cardboard is another thing, because most of the packaging have come on the cardboard. virus can stay up to a day onto these surfaces. So keeping these timelines in place, I think important is really to understand how frequently you need to clean the surfaces to get rid of the virus. But the next question is that how can we destroy the virus? So good news with the coronavirus is that these are enveloped viruses. So when we say enveloped viruses, meaning that they have host-acquired lipid layer around the genetic material of the virus. That's a genetic material that is protected by this lipid envelope. So any virus that is enveloped, they are highly sensitive to most of the detergents and alcohol. So that is really good news. If it is a naked virus, it does not have this envelope, that would be a lot more harder to get rid of this one. So any soap that you use at home would be sufficient enough to break this fatty layer and make this virus inactive. And this is more towards not only cleaning hands, but also hard surfaces. But really it's bleach that is required for the hard surfaces, which does not require that level of sensitivity. So more than 0.1% bleach would be sufficient enough to clear off all the viruses. The next, probably the most common, is alcohol-based sanitizers. So anywhere from 70 to above percentage of the alcohol would be sufficient enough to kill the virus. And then hydrogen peroxide also is very effective on cleaning the surfaces. So any of these one would be sufficient enough to clear off the virus from any surfaces. The next question is like how coronaviruses transmit. I think now we have had established enough that is transmit through droplets, and it can go very far now. I mean, through droplets, through micro droplets, and so on. And the purpose to show you this slide is really to emphasize is not just that it is in the air, but if you're coughing and sneezing in house, then the associated surfaces could also be contaminated. So until you don't clean, those virus would stay in there. But in public gathering, the major emphasis should be on to the breathing, coughing, and the contacts through contaminated surfaces like elevators, door handle, shared off mobile phone, and etc. So understanding these one and keeping these surfaces and these concepts in mind is absolutely important to plan any cleanliness in daily life. So I just want to show you two small videos to give you a scale of the contagiousness of this virus, because this appear to be highly contagious in the nature, because we haven't seen such contagious viruses in the history, and those are the ones that are causing a certain level of mortality as well. For example, if we look onto the influenza virus, if one person infects the next one, and then that person infected infect another 1.2 to 1.3 people, and those are then carrying on passing the infection. So after 5 cycles, only 45 people can be infected. But when it comes to the coronaviruses, because of their infectious nature, at least 2 to 3 people can be infected. So in 5 cycles of the same cycle as, for example, in comparison to influenza, more than 350 people can be infected. So you can see the scale of this infection. And probably that was the reason that it took the world by storm, and it's spread so much that within 3.5 months, we have over 1 million people infected. And these 1 million people are the ones, those are confirmed cases. There are a lot more, those are not tested. For example, even in the UK, only people who are showing severe clinical sign, they are hospitalized. These are the ones, those are tested. Not everyone in the population is tested. So if we test everyone, the scale would be even more higher. But that also really remind us that social distancing and staying home is absolutely important, because if you don't do so, the number of cases would carry on increasing, as you can see from this animated small video, that the expansion of this scale. So if you are not practicing any social distancing, carry on vertically and carry on increasing significantly. But if you implement social distancing, so you will see a massive decrease into the the number of cases on a daily basis. And this is starting from limited number of people. And if it is practiced on a country scale, you can imagine the impact it would have. Okay, so having said that, I think one of the important questions at this moment is really whether to wear masks or not. Let me take you through a few of the important things here, because it's important to understand. So when World Health Organization recommendation are considered, they say that if you are sick or taking care of the sick people, wear the mask. And CDC yesterday announced that if you go out into any public gathering, you can wear the mask, but that is voluntary. So by both organizations, it is not compulsory. And why it is not compulsory is because they've been looking into the data and studies into those viruses, those were less contagious. Okay, so for example, they generated this data from influenza, from SARS and MERS, or from other respiratory, like respiratory syncytial viruses. So there isn't any particular population level study that has been done on this coronavirus. And if they would do so, they would certainly come up with the conclusion that wearing face masks are absolutely important. And just to give you perspective, in 1918 Spanish flu, it was compulsory to wear the masks. Of course, at that time, we're talking about 100 plus years. At that time, the world was not as organized as it is now, like WHO wasn't really in the existence. At that time, Red Cross was asked to sew the masks and distribute it. And there was a penalty for people who were not wearing the face mask. So what happened is that those face masks tradition were carried on in the Asia, in the Middle East, but that was somehow left over for the Americas and the Europe. So now they are getting back to the same norm to have the face masks. Let me give you a few reasons why face mask wearing is important for coronavirus. There are three important factors to consider. The first thing is that if you look onto the guideline of the World Health Organization, they say if you are sick, wear the mask. But we know that around 20% of coronavirus infected people, they are asymptomatic. So basically, they are sick in one way or other because they are infected, but they don't know. So therefore, if these 20% of people are not wearing the mask, they are shedding the virus and infecting another 20%, and then 40% and 60%. That's how the virus has been disseminating into the world and taken the world by storm. The second factor is the R naught, which is how many people can be infected from single infected or sick person. So as I said before, most of these studies and the recommendation on wearing mask has been onto the studies conducted on flu. But that is really half of the R naught, the infectiousness and the contagiousness. So if you look onto the coronavirus, it's a lot more contagious compared to the flu. Therefore, you can't apply the same recommendation that you have made for the flu because, for example, the drugs those are made for flu cannot be used for COVID-19. How can the face mask wearing could be recommended for the coronavirus? Another thing that is coming up very clear now that although we believed that up to 6 feet is something like a very common a distance virus, coronavirus would cover if someone who is infected sneezes or cough. But now it became clear that the micro droplet can go as far as 18 feet long distance. And if they do so, that is where the problems comes, because if someone is wearing the mask, they are gonna really take a full control of that infection, and the virus wouldn't go into that quantity into the environment. And if it doesn't go, even if it stay for shorter time, still it would pose the risks. So my recommendation, although WHO hasn't advised anything on that yet, I think they are in discussion here in the UK. There is an advisory board that was also discussing whether to recommend wearing mask or not. But from my perspective, once again, I would like to highlight that that is my own perspective. If I would go out in the public, I would wear the mask given the reason I described before. I think no need to mention, because now we all are clear that there are different kinds of masks. Doesn't matter which one you wear, it would certainly have some element of protection. I don't recommend you wearing the respirators like N95 or N99 or N6 or FFP2, which is the European name of N95, but because that is where highly exposed people require them, so leave that one for them. But any of the surgical mask or homemade cloth can be used. I just want to put this one up just to remind you that there is a specific procedure to wear the mask on, because if you don't use the mask in the way it is recommended, it's gonna be increasing the infection than decreasing the infection. So I leave this one on for you to read. It's a simple procedure: washing hand before and after, look into which side goes inside and what goes outside. Some people have been talking about whether we can reuse it or not. Surgical masks are not really made for reuse. However, the cloth can be washed, dried, and reused. So I just leave this thing over there, but keep watching on to the authentic sources such as WHO, CDC, or Public Health England if they start recommending using the face masks. Right, so we are coming to the end of this short talk. One question that probably everyone is asking, because whenever I go onto the media, one way or other, they do ask when the lockdown would end. So there are two perspectives I would like to highlight here. Is that one perspective is that if we won't have any vaccine or the treatment available in near future, when then can lockdown be ended? So that is only possible if our number of cases would drop significantly for a sustained period of time, say for a fortnight. And that would only be possible if we all are observing the social distancing guide given by the health authorities. Another thing is that if health services, they are in the position to really cope with the infections. I mean, they have enough facility, they have ramped up enough that they can handle the patient. Still, there is a possibility to ease out and phase out the locking down possibility. The third option is that if the country has ramped up their diagnostic capability such that they can trace, they can identify, they can isolate people who are positive, still they can ease out the lockdown. But that is only when the vaccines and treatments are not available. Let's look into the perspective if vaccines and the treatments become available. In that situation, there would be an effective vaccine that can protect the vulnerable community. There would be a treatment that can be applied to sort of halt the infection. And if we do so, basically we are reaching toward the herd immunity, which is proven way of controlling the infection. So if we have, say, 60 to 80% of the people who are immunized, and then the lockdown can be eased out, mainly because people would be protected. The question about acquiring the herd immunity is debatable, like how would you acquire it? But herd immunity itself is a proven, authentic way of protecting the infection. One question people have in mind is that can we be reinfected if we recover from the first infection? So just to explain in a very simple term, in an oversimplified way, that whenever we are infected with any virus, no exception for coronavirus, we will get a lot of antibodies in our body, unless there are underlying immunosuppressive conditions or genetic issues. So that means that these antibodies, these become available, they are circulating in the blood. Whenever the virus will come in, these antibodies will bind onto it and neutralize the virus. So that is a journal process. So just to give a very short answer to this one, yes, in principle, we will be protected against the reinfection, but it is not known for how long will we be protected, whether we will be protected for weeks, for months, or for the lifetime, because the studies require time and we haven't had enough time since the start of this outbreak to answer this question. So simple answer is that in near time, if someone is fully recovered, less likely they will be infected unless there are underlying immunosuppressive conditions. So one question that I've been frequently asked, so I thought I put it up, is that, the almost whole world is in one way or other is under some sort of movement restrictions. But of course, we can't live without doing grocery and the shopping. So that is absolute necessity of the daily life. So to do so, of course, we can't live without that. There are certain conditions or certain precautionary measures that need to be considered to avoid contracting the infection. So I just quickly scan through, and you will be able to observe this one. First is the same rule apply for social distancing. Avoid crowded aisles in the shopping places. Trolleys and basket handles are one of those things that can lead to transmission of the infection. Do carry a wipe or the hand sanitizer with you. Wash that one up before you take it. Only shop when necessary. You don't need to go on a luxury shopping. Payment by the paper, like currency or coins, are one of the sources for the infection. Do try to use contactless payment option. Perspex screens are now very common in majority of the places. So try to go at the place where they are so that the contact can be minimized. Once you're done the shopping, bring it home, unpack it, and wash your hand. People have been asking, do we really need to wash our vegetables? Majority of the vegetables need to be peeled off, so there is no really aggressive need to wash them. Fruits are also the same. The majority of them, except apple or pear, all need to be peeled off. But if someone is extremely cautious about that, you can always wash them with soap and water. Should clear off most of the infection. Only touch the items when you want to purchase, because this is important. When I go for shopping, people just carry on testing and touching different packaging. They don't need to touch those. Only touch the one that you want to buy. Just pick that one, put into your trolley. And look for the store which are really stringent with the deep cleaning, because if they carry on cleaning, especially the communal places, the chances for contracting the infection would be less. This time, I would recommend don't go with the family. One person can be allocated to go out for the shopping, and that person should carry on shopping for the rest of the duration. So the last bit I want to touch upon very briefly is that about the antivirals and vaccines, where we are at this moment. The short answer is that there is no recommended vaccine or treatment available at this moment. And let me expand onto this one, that there are 4 different combinations. Those are being tested on accelerated scale, not only under the supervision of World Health Organization, but every country is having a certain level of testing. The first one is remdesivir. It is a generic antiviral. It's being used for many viruses because it is a RNA inhibitor. So it can inhibit any RNA viruses. So it's been used before. That is being tested. Chloroquine and hydroxychloroquine have acquired quite a lot of media attention. Those are anti-malarial drugs. Hydroxychloroquine is relatively more safer than chloroquine, but these been tested against influenza before, but they didn't pass through the safety trial. So now we are in an emergency situation. There might be possibility that one of them would be approved. Then there are 2 other drugs that can be applied alone or with interferon therapy. Those are basically HIV antiretroviral therapy in composition. So those are also being tested for their safety and efficacy. But at this moment, since there is no any specific coronavirus specific antiviral, so there is a really a balance between the risk and the reward. I don't think any of these drugs would come without having any side effect, but now it's just a matter of finding the risk and the reward these antivirals would pose. There are 2 vaccines. Those are passing to the fast speed, with a very fast speed toward the approval. One is based on an adenovirus type 5 vector vaccine by the China. So adenovirus is another virus. It's a DNA virus, very giant, big virus. So what people did, they took the immunogenic component of the virus, of the coronavirus, put into adenovirus, and that is being tried. Another one that became very famous, the first one was Moderna company in Seattle in the United States. They made mRNA vaccine. which only take the blueprint and the nucleic acid of the virus and incorporate into molecules to be implemented. Not only these two, more than 40 different additional candidates are being tested to see if any of them would be proposing advantages to control. But as yet, there is no vaccine or treatment recommended by the regulatory authorities. So just the last thing I want to highlight, one thing very important, and that is that every one of us are asking, how can we minimize the impact of COVID-19? I have been covering this coronavirus when even its name was not known. It was a mysterious disease at the end of December. And I've covered it over 180 times on radio and TV in many countries, and been sitting with the advisory board with the people who are taking the decision for that. My conclusion is that there are three kinds of responsibilities. First is international responsibility, such as CDC, WHO, how they regulate the overall monitoring of this infection. And then there is a national responsibility, like every country has their own health policies, how they are acting. Both of these are absolutely important, but those are not something that at the level of individual approach. I think the thing that you and me, every one of us can do is really the personal responsibilities. So based on these personal responsibilities, I would say that the best thing is to follow the advice being put by the national regulatory authorities, such as avoiding contact, applying the social distances measures, wearing mask. It could be N95, I don't recommend that, but any of the surgical mask or the cloth one. Cover your face, sneeze into bent elbow, wash frequently your hands, and cook the food, and try to avoid the contact with the contaminated surfaces. So that is what really an individual person can do, and I think that should be our focus. With this brief skim through, I would be open to answer any question you have related to virology. I will be very happy to discuss that one with you. Thank you.
Thank you so much, Dr. Mohammad Munir. I have to say this, mashallah, one of the best so far that I have listened to really on coronavirus. May Allah reward you immensely, mashallah. You are such a busy individual for you to give time for this Balagh's webinar. So as you would expect, mashallah, there are more than a dozen questions which are waiting in the line. So I'll try and go through them. Try not to put the questions that have already been addressed. Okay. So if I can just say this, Dr. Munir, I mean, you mentioned, of course, that the guidelines at the moment say that 2 meter distance, but when you said 18 feet, yeah. Is this something someone might come across and say, right, okay, that's scaremongering, that's a bit too much really, because that's the first question I can see here. One of the sisters has mentioned there, going for shopping for non-essential items. What concerns me is maintaining the 2 meter distance. Now, of course, there is this mention of 3 meters now, nearly, more actually. So what do you advise?
Yeah, sure. I fully understand that. The thing is that coming up like this, that the droplets, they are no further than 6 feet, which is like 2 meter. That is fine. But then there are micro droplets. So if you are indoor, like in household or in indoor activities, although it is recommended not to have any gathering, but if you are indoor, the chances for this virus to go as far as 18 feet is likely. So I was telling up to 18. So even if you practice 2 to 3 meter, which would be 6 to 9 feet, that would be sufficient enough in general cases. For example, if you are on a walk, going through very dispersed gathering, 2-3 meter is sufficient enough.
Right. So coughing and other question from an anonymous attendee is coughing and sneezing classified as aerosol generating, and So if that's the case, why aren't we advised to wear FFP3 masks or respirators on general wards where COVID positive patients are treated?
Yeah,
And we only advise to wear surgical masks. Of course, this question is a very specific one. Someone
sure.
apparently who hasn't been advised to wear FFP3 mask on their wards.
Yeah, exactly. I think there is a very solid reason for that. The main important reason is that when the health worker, they are working very close to the patient, right? And they are not only exposed once, but they are exposed multiple times in a very short time. So the surgical masks, they need to change them very frequently, and changing itself required time and a special procedure. They need to wash hand before and after. They need to go to the place where they need to wash that hand. So that required time. And as you can anticipate with the current situation, every minute of those health worker are crucial, can save the life. So therefore they recommend to use something like a respirator that can be kept for longer duration.
So you would recommend wearing a respirator rather than?
Yes, absolutely.
Right. Okay.
For the healthcare workers or the people who are taking care of sick people for a longer duration. For the general public, the general surgical mask would be sufficient.
So the next question is, if you're living with a high-risk individual as a potential asymptomatic carrier, do you need to wear a mask at home?
Well, if for let me give you an example. If there are 4 people in house, one of them is vulnerable, belonging to the vulnerable group. The rest 3 or all of them, they are not showing any clinical sign or something like that. Instead, that they can wear the mask in-house, I think better would be that they would obey by all the control measures that have been put in place, like not going outside the house, social distancing, and that sort, because that would protect everyone in the household. So therefore, my recommendation in the house would be to avoid the contact with the virus and try to make sure that everything is neat, clean, and tidy than wearing the mask in-house. But of course, when they go out in the public, they should wear the mask. That is my recommendation, and that is how CDC suggests that when you go out in the public, that
Yeah.
you need to wear.
A couple of questions. Again, my pronunciation of the antivirals isn't great, so correct me if I'm wrong. It's about the antiviral. I heard ivermectin, I think that's the right pronunciation, I don't even know,
Yeah.
has efficacy against CD4 receptor site of virus. Is it true?
Well, ivermectin is one of the oldest drug and being used as a dewormer. So for external parasite, internal parasite, it's very effective. I have been reading quite a bit about the ivermectin. Although the studies those being conducted are not very well executed, there might be some antiviral activity, because not only that these are CD4 related, but ivermectin also have some role with the nuclear translocation of different viral proteins. So it might have antiviral activity, but before anyone can take the injection or the tablet for those one, please do wait for some time until a precise, well-executed study is conducted and WHO take the notice of that, or FDA, they consider that one. So there is always a possibility, because we don't know a lot about, to be honest, about these viruses. So anything should be considered and should not be overlooked.
We've got another interesting one. Again, something I can relate to. I went to a funeral a couple of days ago, a COVID-9 death, and basically, of course, we kind of did the usual things of social distancing. We had no more than 10 people attending the janaza, but then people were using a homemade disinfectant. A question has come from one of the attendees similar to that. Is a standard insecticide, pesticide be used as a disinfectant?
Well, that is really a tricky question. All I can tell you is that virus is very fragile. Anything that is carrying bleach, hydrogen peroxide, alcohol, it will kill the virus. But I wouldn't go really too far for the, insecticide and pesticide. Those are really harsh reagent. And probably you would develop resistance against those pesticide continuously using that. That would be a lot more dangerous than the coronavirus itself. And homemade remedies, I don't recommend for one of the reasons. It might work if someone is really cautious, but just assume that whenever any drug or any kind of these hand sanitizer or anything is recommended, it passed through certain regulation, looking on to pros and cons. So they won't recommend anything that is having more disadvantage than advantages. So therefore, whatever you will be making at home, that is on the discussion of your own self. I wouldn't have any control study to really, well, so the bottom line for this question is that if you have a possibility to use commercially available, well-controlled and well-prepared hand sanitizer or disinfectant, please do use so. Try to avoid making at home.
Another interesting one, and something I think which has come across before as well, especially recent deaths of our ENT colleagues. Is there a proportionate relationship between viral dose and severity and symptoms? For example, if only a small dose of pathogens, then the symptoms will be mild. Is there a direct relationship to the actual dose?
Yeah, absolutely. That's a very important question and very good question. I must clap for that guy, right? So the reason is that, just assume that. So let me clarify one thing very important for general public to understand is that you need around 100 to 1,000 viruses to get infected. If you get across like 2 or 3 viruses, you won't get sick, because our immune system does a remarkable job in general term. So on a daily basis, we are infected with thousands of pathogens, but we hardly get sick, right? So a couple of viruses, coronaviruses, won't make you sick. So you really need to get a heavy dose of that. So just assume that people, those are working in the front line in the healthcare system, they are the one, those are suffering the most, primarily because they get heavy doses of the virus, not only once, but multiple times in a very short time. So what happened is that the body doesn't have enough capabilities to cope with that heavy load at once. So therefore, the chances for them to get sick in a very short time is really high. But if you are exposing yourself, for example, with maybe 100 of viruses on daily basis, body would cope with that. So to just wrap up this answer is that yes, the dose of the virus and how frequently it interact with your cellular receptors does make the difference on the severity of the infection.
Again, I'm sure you must have answered this question 100 times. How much time will be required before we expect vaccines coming in the market?
Yeah, I think this is a very tricky question. Although I am myself working on vaccine, I haven't announced that because I wanted to make everything done before I bring that into the market. So hopefully in 2 weeks' time, we would be in the position to announce that. There are 2 important critical steps here, which I've been waiting and we've really been trying to mitigate those. One is the manufacturing, other is the testing. And the third challenge is mass scale production. Apparently, it seems like, oh yeah, we will produce it day and night, we put it and produce it. No, that is not really the case. So the first part, which is the development part, that is already done. I mean, as I was mentioning, there are like 44, 46 different vaccine candidates at different scale. So the development is done. Now the vaccines are into the second stage, which is the clinical trials. So some of them are advanced, others are behind, but that is probably also okay. But the major challenges come into the production line, because when we are talking about coronavirus vaccine, we are talking about millions and trillions of doses. So any vaccine that proven to be very effective, but yet very difficult to scale up, that would be of no use. So considering all of these complications, I don't really see that the vaccine would become available in this year. It would be available earlier next year, and hopefully we would have controlled this outbreak and this pandemic by that time. And if, God forbid, would be the chance that this virus would come back in a second surge, then we would have the vaccine available. I don't think we should anticipate a vaccine would become available for this outbreak.
Serological testing. Again, I think you might have touched on it. Is there any serological test for early detection available at the moment?
Oh, yeah, there are, and there are, even in the UK, one of my collaborators here in Liverpool, they are working on very effectively. Early detection cannot be expected with the serological assay, because when virus come in, body takes some time to develop antibodies, and those antibodies are then detected by the assay. So early detection can only be done by the PCR, which are genetic testing. No, not really. However, serological testing are absolutely important for later stages of the infection, because when I was saying the locking down will be eased, that would depends on how much is the immunity in the population. And for that one, we would require the serological assay to demonstrate how many people out of 100 are immune to. So those would be of value, but later in the outbreak. At this moment, more important is to have genetic testing, which required the like PCR and so on.
I mean, again, a very common question we're coming across these days is, again, the chances of transmittability of the COVID-19 from a deceased person. There's been, a number of organizations who have issued guidelines, WHO, European Society, CDC. There's a lot of concern in the community about that. What do you think? Is there sufficient evidence to prove that there is that risk there?
Yeah, well, certainly this virus has a few unique features, and one of the unique feature that has surprised the virology community is transmissibility. Because what we have seen so far, if we look into the history of say 100 years, the diseases have two categories. One category is the one those are very lethal, like Ebola virus, 80 out of 100 infected could die. Those are very short-lived. And then we have other diseases. Those are not too much lethal, but they are more contagious. These are the ones those live for longer because the viruses are more stable. Viruses, in contrast to bacteria, they need us to replicate. They can't replicate on their own. So viruses don't want to kill us. It's basically we, either our immune system or because of environmental factors, we die. Okay, or we can't cope with the number of factors that are contributing. So it is not in the favor of virus. So this virus appear to be finding this fine balance between the transmissibility, contagiousness, and also the case fatality. And these viruses are unfortunately more stable in the environment. So it would be, it is basically here to stay, unfortunately. And also, of course, it is very transmissible between people.
This one is a quite technical one. It is said that in some cases, erythromycin hydroxychloroquine is effective. Even knowing that protein blocker antibiotics should not be used in viral infection. I'm not a virologist. I don't know really. Is that true that protein blocker antibiotics should not be used in viral infections, Dr. Munir?
Protein blocker, or you mean the receptor blocker?
The questionnaire just said protein blocker. I'm assuming he's probably talking about receptor blocker.
Probably. Okay, let me put both into the perspective. Protein, there are certain antivirals. What they do, they stop the preparation of protein, which translate from the RNA. So if the protein of the virus is not being made, then of course virus wouldn't be able to replicate and complete. There are certain antivirals, but here I think the more relevant question is about the receptor blockers, because ACE2 is the receptor for the coronaviruses, and those ACE2 receptors are essential part of our immune system and maintaining the blood pressure and so on. So if we use the drugs that can block the receptor, it's going to affect onto our immune system and the cardiovascular system itself. And we might be protected from the coronaviruses, but then other opportunist pathogens like bacteria or other viruses, they would be getting the chance to infect us, and we would be in a worse situation than the coronavirus itself. So these are basically those questions that WHO and FDA, they consider before they recommend any drug to be used. So that is, where the confusions come, like why, if it is protective, why can't we use them? But just assume that if the study has been done in a healthy population, okay, it might be protective, but when it comes to the application in a mass scale, you are talking about pregnant women, you are talking about immunosuppressed people, you're talking about children, you're talking about cancer people. until you don't do the studies where it is safe in every cohort of the population, regulatory authorities, they don't recommend that.
Excellent. Another tricky one here. The brother here mentions that, you mentioned regarding lifting of lockdown that we should wait for a 14-day period where we see deaths are stable, controlled, coming down. At present, we are seeing that the death rate is still rising. What is your anticipation? When do we expect this lockdown to finish?
Yeah, very good question, but answer is very difficult to answer because every country is in a different stage of the disease. So it is really difficult, almost impossible for me to answer for every country. But let me give you an example of the UK because that is where I've been, assessing the data. So, and then you can put that into the country of your perspective. So my anticipation is that by the end of May in the UK, we would have around 20% herd immunity. Okay, so when we have 20% herd immunity in the UK by the end of May, that means that in June or July, we will be reaching close to 50%. And if that is the time, when we achieve 50% of the herd immunity, that is the time when government can think of, phase-wise releasing the and easing out the control restrictions and the control measures that have been put in place on terms of social distancing and so on. So the short answer for this one is that in UK, it would be June, July, that would be the time when we will be easing out our control measures. And given the condition, there is no therapeutic and no vaccine available. But for miracle happens and something become available before that, then this time will be short and shrunken. But again, that depends in which country you are in and where you're referring to. For example, if we talk about many countries in the Middle East and in Africa, those are in a very early stages of their disease course infection, natural course of infection. So over there, the scenario would be different. So it need to be assessed at the country level.
Right. Okay. So you're thinking May, June likely, probably earlier if a miracle happens, as you said.
Yeah.
Questions keep on coming. Dr. Munir, you're really sought after today.
No problem.
I was speaking to a couple of colleagues today, actually. Both of them were affected by COVID. They were COVID positive and they were self-isolating. MashaAllah, they are recovering very well. And this is a question really relevant for them as well, actually. How quickly do you become immune after infection?
Right. That's very, very important question, actually, because, well, I am involved in taking care of few people who've been infected within my vicinity. So I can answer that one very well. So once you are infected, say day one, within 4 or 5 days in a normal, I'm talking about the average of everything, because there is always outliers up and down. So I'm not talking about individual, I'm talking about a general scenario here. 4 or 5 days after infection, people start to see the clinical sign, and those would remain for another 3 or 4 days. So in total, after 8 or 9 days, most of the infected people, they would have sufficient immune system activated, antibodies are made, and that is the time when your antibody test would work, and that is the time when people start feeling better. And then within next 3 or 4 days until day 14 of post-infection, you will be all clear and relief. And now just one very important question some people might be thinking, if I would have antibodies, would still I be transmitting the virus? Yes, if you are in the window of 5 or 6 days post-infection until 10-day post-infection, in these 5 days, you would have still antibodies. Those are being made by the body, but those are not sufficient enough to completely neutralize the virus. So you would still be shedding the virus. So during this time, you can infect other people as well. But once you are fully recovered, then the chances that you will be shedding the virus and infecting other people would be extremely low.
Another question, I think this is kind of a common theme I'm seeing about masks and government advice and what's the advice that people are getting from their trusts. So, Brother Zakaria, he's asking, I'm a healthcare worker, and PhD have advised not to wear FFP3 mask unless doing aerosol generating procedures. Many colleagues are reporting patients coughing and sneezing on a general ward when they are wearing surgical masks only. Also, we advise that the mask can be kept on for long periods, even between patients. So a lot of contradictory advice in between trusts. I mean, what's your take on that?
I completely echo you. Honestly, there's a lot of confusion. Today morning, I had a long chat with the CNN, and major part of this discussion on the interview gone to the face masks, basically, because the problem here is that whenever I speak to the media, I mean, this is a very unusual way of conversation. You know, in media, you have like 4 or 5 minutes to cover up everything. I try to make the thing simple, because to me, confusion is more damaging than not having any advice. So we are in that situation when it comes to the face masks, that regulatory authorities are asking different, data states different, virologist and the epidemiologist, they propose different, and the provision is different. For example, in NHS, of course, first is they are taking care of the, the number of PPEs being used, because that's been asked for. Secondly, NHS has not been recommended by the Public Health England yet to start wearing the mask and, at every place, although they should be, because they are the ones that are exposed the most. So this is really, again, down to the NHS when they decide to really take this matter very seriously. I wouldn't recommend by any means to wear the surgical mask twice even, and they need to wear aspirator really, because the people who are getting sick, when they are showing clinical signs, that is the time when they are shedding the most quantity of the virus, and they are under high load, especially because they are indoor, and not only one patient, multiple patients are in the same under the same roof. So the virus load is extremely high in that environment. So they need to be more cautious than a normal healthcare worker, for example, in the nursing house or take carer or so. So really, better to ask the authorities, because they are the best in the best position to suggest anything. If it would be my postdoc or anyone, I mean, we do work with the coronavirus straight away to N95.
Absolutely, absolutely. I mean, that's the thing that, kind of in an ideal world, in a realistic world, and if you were only listening to people like yourself, we probably would have that policy in place.
Yeah.
Right. Okay. So going on to the next one now, this is a question more about association between BCG vaccination and the mortality of coronavirus. So what this says here, there's a recent epidemiological study presented from USA that showed countries with no universal BCG vaccine for TB show higher mortality from coronavirus than countries with universal childhood BCG vaccination. Is there any reliability to this hypothesis?
Yeah, it's very early to say that, but since I work on to the viral immunology, I do understand a little bit of immunological side of it. So if it is true that BCG vaccine is protecting against the virus, is mainly because when you use BCG vaccine, it activates your immune system, especially the cellular immune system, like T cell and B cells, the cells that are required to make antibodies. So since they are already activated, any pathogens that come in, they take it and really act against that very strongly. But I would be extremely surprised if there would be any direct antiviral effect or direct impact onto the virus. But even if it is indirect, it is positive because the immune system is activated. That's what you want. But again, it is very early stages before I can commit anything, because once again, I wouldn't say anything that is not backed up by science. It's just to be cautious, because the worst thing we want to see is to use the wrong thing for the right issues.
Wrong things for the right issues. Right. Okay. Now, I know you're a virologist, but there have been some clinical questions regarding breathing exercises. I mean, feel free to answer them if you feel you want to. So there have been some videos circulating on the media, some of the intensivists, some of the doctors. I've seen a couple of doctors who are sharing the advice about deep breathing exercises and coughing. I mean, I've listened, well, I've actually just seen one video this morning. Is a doctor, intensive care doctor, who's advising taking deep breaths and holding in for 5 seconds, and then repeating it 5 times, and then following it up with a cough. Also about lying prone. What's your take on that?
Yeah, it's very important to understand that there are two kind of remedies. One is directly antiviral remedies, other are the supportive remedies. So for example, if you can't solve the problem, what you do is you try to make it streamlined. I usually say that, I mean, sometimes it's a little too personal to tell here, but it's a really good message. I support many people on a very personal level on different aspects in the society. And some people say that, well, they are the one that are going to bite you back very hard. I said, well, I have only one simple principle, and that is, if you can't protect anyone falling into a well, what you can do is to make the well comfortable, isn't it? So the same apply here. If we don't have any antiviral, what we can do is to strengthen our immune system to make it a capacity enough that it can tolerate any pressure that comes through the virus. So if you can expand your lung capabilities, you can make a healthy activities, exercising, inhaling, exhaling, fresh air, of course, carry on doing so. But that would certainly will help you in sort of fighting the infection, but doing so, don't expect that virus will not cause any damage to you.
Can you elaborate more on the second surge and how much of a risk it would be?
That is the major worry. Very good question. The problem it happen is always happening in most of the pandemics, that the second surge always come, and especially for the diseases, those are staying for longer time. For example, this COVID-19, it is staying for longer. It will stay for longer time. We will get exhausted. Government would be economically damaged. Everyone wanted to get out of it as quickly as possible. And when these pressures are there, the chances are that we lift our control measures earlier than they're supposed to be. If the second surge come in, that would be very lethal for two reasons. First, that we would be exhausted. We don't want to go into the lockdown again. Government is economically not in the position to offer incentives. No one wanted to do, and we will succumb to the infection early. So in the developed world, probably that's not going to happen because governments, they do have understanding. It's more worry about the developing world where they take many things for granted, but certainly the chances is that or there that the second peak would come. How intense would it be? That would entirely depends on the policies government would impose.
So antibody production linked with how well the immune system is functioning. So this is a question actually: is the antibody production linked with how well the immune system is functioning? So what actionable advice could be given to those who are immunosuppressed, either taking the medicines or have got an underlying condition? Is there any way of bumping up the immunity and bodily defense for these individuals?
Yeah, I think this is basically a very good question for doctors and the GPs. But I can tell you, based on my experience, is that if someone is immunosuppressed, that mean or they are taking any medication that is immunosuppressive, meaning that they would be falling into the vulnerable category anyways. So they have to carry on with their medication, because otherwise they would be coming to the infection earlier than the regular one. And then really look into whether they can reduce the quantity or they can do something else to really boost their immune system, but they should not stop their regular medication, the one they are taking to treat their infections.
I'll try and take two last questions. But this has by far been the longest Q&A we've had, mashallah, a lot of interest. In South Africa, we've had a huge burden of HIV with the highest proportion of patients on antiretroviral medication. We are 2 weeks behind all other countries with respect to the exponential rise in confirmed cases. What is the likely impact of the virus on patients on antiretroviral or patients with TB?
Yeah, I mean, this is a very complicated situation, especially in the countries where the TB and HIV are together. Well, I don't work on HIV or TB, but I do teach both of these diseases, so I have a bit of idea how these work. So the majority of the HIV positive cases, they are TB prone as well. So when those both diseases are there, they are extremely immunosuppressive. And if they are immunosuppressive, not only coronavirus, but any other virus, they're gonna likely hitting them very hard. And South Africa, they not only 2 weeks behind, but also the control measures they have taken, they are very nominal. So unfortunately, worry is that the wave coming to South Africa would be really hard, just because of other infectious diseases, background noise, but at the same time not taking measures at the right time.
Okay, I'm just going to take two more questions because they keep on coming up. I don't want to take more time than we've already agreed on. So one question which is very pertinent, and again, more a clinical question. Do you have any general advice for people for the upcoming Ramadan, people who are generally fit and well, but with the coronavirus being a major issue this year? What is your advice regarding Ramadan and
Yeah,
fasting?
very sensitive and very interesting, important question as well. I've been approached by BBC to do a live debate onto this one because Ramadan is coming and they wanted to really clarify with this one. If someone is healthy, no underlying causes, they are taking all the precautionary measures, my take is that do go as you would normally be going. If someone is sick, have underlying causes, or in the elderly group, like 70 plus, again, this is a more in terms of religious question, which I always hesitant to answer because I'm nowhere really understand that that aspect. But for scientific basis, because they are prone to other infection and other diseases anyways, I think Allah will forgive them if they would avoid if someone is really sick and have underlying causes. But if they are healthy, they follow all the precautionary measure, they should carry on like a regular one.
I mean, we are expecting a full lecture on this. I mean, I was speaking to Dr. Sheikh Rafaqat earlier today, and apparently, of course, the threshold for not fasting is definitely going to be lowered because of the unknown and a lot of emphasis on having good immunity and all that, and perhaps fasting might impair that in that sense. But again, Jazakallah for answering that. Again, we weren't expecting a fiqhi answer, more a medical. One last one, and I'll finish with this. A number of people have asked the same question. Would you recommend any vitamin supplements that would help boost your immune system, especially with respect to the COVID-19?
Yeah, this is tricky and risky at the same time. Allow me a minute. I want to explain this one to you because I've been seeing on the media as well that a lot of people have been recommending on immune stimulation and like this. The problem is that we don't want to induce the immune system when it comes to the coronavirus infections. And you will take this one as a surprise. Why is that? The reason is that this ACE2 receptor that can be induced if your immune system is hyperactivated. So if it is induced, that means that it would express on every cell and more viruses can bind and enter into the body and can cause lethal disease. So we don't want, and you will be surprised to hear that in influenza infections, majority of the deaths are not because of the virus itself, is because of the cytokine storm, because of the hyperimmune system. Because hyperimmune system, the activated immune system is not good for us because it is suicidal. It kills our own cells and make the infection more likely to get worse. With the coronavirus, since we don't have a lot of information yet, what is really the underlying causes? Like we do know that, okay, yeah, with the cardiovascular respiratory issues, those are vulnerable, but we don't really know the molecular details of that. So I would be really cautious to take these immunostimulatory drugs. I would at this situation of ambiguities, I would take a middle ground, not really boosting too much, but also not to be deprived of the immune system. I hope it will generalize not only for vitamin C, but any other immune stimulant people be thinking of.
Jazakallah khair, Dr. Mohammad Munir. As I mentioned before, this has been the most informative session that I've attended, either on TV, live interaction. And you can see, I've got a tally here. I think you managed to answer 30 questions, Michael. You still got around half a dozen still which remain unanswered. But we don't want to take more time. And may Allah bless you in your health, in your faith, and you continue to serve the community. MashaAllah, you're such a busy individual. For you to give time is just amazing, and MashaAllah, it's been an honor for us to have you on our program. For our attendees now, I'd like to just say that please do keep on attending our webinars. As you know, this was the second of the 12 in our series. Please do advertise it to your friends, colleagues, families. Especially the upcoming webinars will be more focused on the spiritual, psychological side of things. I think it's really, really vital, as we are seeing in Nottingham. We've had 3 deaths so far due to COVID, and in other areas as well. May Allah forgive them all. May Allah raise their ranks. But more so for the families who haven't even had a chance to, of course, say the final farewell to their beloved. So it's a difficult time for everyone. Please do share the link, inshallah ta'ala. And with that, we have come to the end of our program. Jazakallahu khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.